Okay, so my patient case was on a patient that had multidirectional shoulder instability. And so this patient has received the open Latarjet surgery. And so based off of the 3 protocols that I found, I'm using a combination of 2 to implement the phase 1 of the protocol that we're going to do today with this patient. So the important thing to start off with this protocol is that for the first 0 to 3 weeks, the patient's only doing passive range of motion. So they're going to be in a sling except for when they're in the clinic doing their rehab. So they're not going to have any active range of motion. It's all going to be passive. So when you bring them in for treatment, you can go ahead and do some, introduce them to their passive range of motion exercise for the shoulder. So 0 to 3 weeks though, you want to avoid extension, abduction, and internal rotation. So you're limited to external rotation. So you can have a patient not past 90, so you have a patient here, and we can just bring them back into external rotation. And we're going to do this 3 sets of 10. Unless the patient starts to experience any pain or any uncomfortable feelings, you're going to stop, because all these passive range of motion exercises should be done at the tolerance of the patient. So then you can also go ahead and start to introduce flexion. So you have a patient, again, they're completely relaxed, and you're bringing them up to the first end feel or to 90 degrees, whichever one comes first. And so you're just going to do this for 3 sets of 10. That's the 0 to 3 weeks. And so the 4th week, they can begin active assistive range of motion. So that one, they're going to be actively raising your arm up, but you're going to also be assisting them. So I'm going to instruct the patient, go ahead and bring your arm up in front of you. And she's going to bring it up, but not to her full capability. So now relax. All right. So we're working together to bring her through her range of motion for flexion. And then at this point, you can start to introduce an active range of motion for your external rotation as well. So you can have them here. And I'm going to ask Seraphina to go ahead and start to bring her arm back. And as she's doing it, I'm kind of taking over as well and assisting her with that. So then after that, within, again, the 4 weeks of phase 1, they're going to be doing active range of motion for the wrist, elbow, and hand. So for this one, we'll have the patient, for the elbow, since they're here, while keeping their arms down by their sides to ensure there's no active movement of their shoulders, they're going to just go elbow flexion like you're doing a bicep curl, and down. And then she's going to do that for 3 sets of 10. And then for the hand and wrist, or for the wrist, so the patient's going to be seated. I'm going to grab the phone. And the patient is going to bring their wrist up off of the table. Alright, and now you're going to go in. Okay, and then she's going to go out. And she's going to go down. So the patient's going to do that for 3 sets of 10 each direction. And again, that is all active, so that's the patient performing those motions. And then on top of that, they can also be doing grip strengthening. So if you have, a lacrosse ball, a tennis ball, anything, roll of tape, you can have them squeeze that. So for now, she's going to squeeze this because it's all we have. So she's just going to squeeze that as hard as you can, and then relax, squeeze, and relax. So she's going to do this 3 sets of 10. She's going to hold the squeeze for about 3 seconds before she relaxes to ensure that she's getting enough strengthening of her forearm muscles. Along with this, you can have them doing a lot of the grip strengthening exercises. So putty, TheraBands for the fingers, all of those can be beneficial in 2 weeks after surgery. This patient can be performing pendulums. So the first set of pendulums that they're going to do are going to be front and back and side to side. That's going to be what they're doing for the first 2 weeks. So the patient is going to be holding onto a table, and they're going to lean over so that their shoulder and their arm is completely relaxed out in front of them. Okay? So then I'm going to instruct her to do the front to back one. So you're going to just kind of rock your body, but keep your whole shoulder relaxed so that it's kind of just hanging and rocking like a pendulum would. So good. So the patient is relaxed and she's going front to back, and so now to instruct her to do the side to side one, I'm going to have her just doing the exact same thing. So you're moving your whole body side to side while allowing their shoulder to rock. So then to progress this, so weeks 3 and 4, you would progress them with pendulums through giving them the instructions for clockwise and counterclockwise pendulums. So again, it's the same concept. They're just holding on the table, they're bent over so that they're relaxed and their shoulders hanging down, or their arms hanging down in front of them. And you're going to instruct them to make a clockwise circle. So just kind of moving their upper torso around can help make this clockwise pendulum movement. And then to do counterclockwise, you're just going to do the exact same motion except the opposite way. Good. So the patient would do each of these pendulum exercises 3 times for 30 seconds. And then the last part of the phase 1 for this surgical intervention is going to be isometric scapular stabilization exercises. So the first one that they're going to do is just essentially it's going to be like a 4-way scapular strengthening program. So the patient's going to do shoulder shrugs. So they'll come up. Good. And then she's going to push down with her shoulders, depress her shoulders a little bit. So she's not going to get much range of motion, but I mean, that's normal. And then she's going to do retraction. So I want you to keep your arms out by your side, but squeeze your shoulder blades together. There you go. So she's going to do that, like she's squeezing a ball between your shoulder blades. And you're going to come forward, so hands by your sides, palms in, and then just kind of squeezing your shoulders forward and in. And that's going to get the protraction for the scapula. So those are not isometric exercises, but they're scapular stabilizing exercises. And to progress these, you're going to have the patient, then you can add resistance bands. So by week 3, you can start to add your lower resistance bands. And then progress them up by color as they go and as they're getting stronger and stronger. So just for retraction, they would hold their band here and they would just come out. So that's the phase 1 for my patient. That is the first 4 weeks for her post-surgery.